The other thing we want to be cognizant of is that our strongest pass through the tissue will be if we're passing through at 90 degrees to the tissue, we have the least amount of chance that that suture is going to tear the tissue and pull through. If the needle goes in at an angle to the tissue, there's a pretty good chance that if that's tightened, it's going to tear the tissue and eventually pull through. So we want to enter the tissue at 90 degrees, pass through, and then make your turn. All right, so now let's, again, use our suture forceps. Let's grab our flap with a good 3 to 4 millimeter bite. We can invert the flap so that the needle passes through easily. Pass the needle through the hole in your forceps. Advance the needle. Again, now when we go to grab the needle, you never want to grab the needle right at the tip because you're going to be dulling your tip and then you're going to be tearing tissue as you use it on your next suture. So grab the needle down from the tip. Again, go with the turn of the needle to pass it through. Let's grab the other side with our suture forceps. Again, get a good bite. Rotate the flap up. Pass through the hole. And again, when we grab the needle, don't pull straight across or you'll end up tearing the tissue. Go with the turn of the needle. So again, here we're going to do just our simple interrupted with a PTFE suture. We're going to go with 3 loops on the first pass. Kind of when you're putting that in, if you put it in and the knot looks like it's crinkled up, then just kind of rotate your edges so that the knot lays down flat. Now with the PTFE, you can still tighten that first knot because there's some flexibility to it with a single pass on your second loop. Then you do your third loop to lock everything down. Grab your short end at the level you want it to be cut. Bring the 2 sides together. Your assistant goes up against the instrument and you made your suture.